My name is Liz Watson. I am the Executive Director of the Congressional Progressive Caucus Center. I want to thank all of you so much for joining this dispatch from the front lines. This is the weekly series from the Congressional Progressive Caucus Center, where we hear from people whose lives have been upended by this pandemic, from our movement partners, and often from special guest members of Congress who are fighting for policy solutions to help our families and our communities. For those of you tuning in for the first time, I'm Liz Watson, the Executive Director of the Congressional Progressive Caucus Center. The Progressive Caucus Center is a nonprofit organization that works to inform the public about policies that promote justice, equity, and fairness. We work with grassroots leaders, advocates, labor unions, organizers, researchers, and policy experts, and we're so glad to be joined by many amazing partners today. We're grateful to host this special conversation with the American Federation of Teachers, the AFL-CIO, and One Fair Wage. When we talk about reopening, let's first acknowledge there are a lot of people out there who've continued to work right through this crisis. Healthcare workers, transit workers, meatpacking workers, grocery store workers, letter carriers, janitors, childcare workers, and so many others who go to work every single day risking their lives in the face of this deadly virus. And they're often doing so without the protections they need to stay safe. Some have gotten coronavirus, recovered, and returned to work. Others have died. Well, we lovingly refer to these workers as essential. Our policies continue to treat them as disposable, and we owe them so much more. And then we have millions of workers who are waiting at home right now, some of whom have been furloughed and some who have jobs to go back to, some of whom have been laid off permanently. We have millions who are nervous about being sent back to work by their employers before it's safe, potentially being kicked off their unemployment benefits and told, get back out there, even if it means putting your life at risk. We have parents who want to keep our kids safe, I'm one of those, and wonder when will be the right time for them to return to school and to their beloved teachers. And will that time line up with when the parents are required to go back to work? Many of the people who are out of work have been unable so far to access the unemployment system and is wondering, where is my next paycheck going to come from? What is the path back to work and to school that avoids a new wave of infection? What is the path back that keeps people safe? Public health experts have stated that until we put mass testing, contact tracing, and isolation in place, we can't return to normal life without jeopardizing the lives of millions of Americans. But this week, amidst the rising death toll, President Trump went so far as to announce the dismantling of coronavirus tests, focusing instead on reopening the economy. He received significant criticism for this decision, and he quickly backpedaled to say that the task force would remain in operation indefinitely. Despite coronavirus infections and deaths continuing to mount, we do know that more than half of states have announced some kind of plan to lift social distancing restrictions and begin to reopen. This is in the face of 2,000 people on average losing their lives every single day, and there is no doubt that if we reopen the wrong way, this will cost more lives. So we know that the first people who are likely to go back to work are those who can't afford to stay home, a group that's disproportionately low income, a group that's disproportionately Black, brown, and female, many of whom are already risking their lives as essential workers. And while these workers weigh the terrible choice between their paychecks and their health, the Senate is considering adding provisions to shield companies from being held liable for forcing people back to work too soon or failing to protect them at work. And across the country, we have states and localities struggling to find the protective equipment to keep their workers safe. We have crowds flooding unemployment offices, and we have an economy in free fall. States and local governments need more help, and they need it now. And the fact is, the American public agrees. A majority of Americans feel the federal government isn't doing enough to help states that have been hit hard by the outbreak. So how do we reopen our businesses and our public spaces safely? How do we reopen the economy in a way that doesn't put our lives at greater risk? The decisions we make now will determine if this is the beginning of our recovery or if it's the beginning of the next wave of coronavirus infection. We have to get this right. And getting it right means investing in people. It means investing in our schools, in our state and local governments, in our healthcare infrastructure, in our safety, and in providing the income support that people need so they don't feel pressured to return to work before it's safe. So we're joined by an incredible group of guests today who are working to do just that, who are fighting for the public investments that we need to keep people safe. We're going to hear from Congressman Jamie Raskin tonight, who has introduced legislation on how we can reopen safely, legislation that is based on science. We'll hear from President Randi Weingarten of the American Federation of Teachers, and from Rebecca Reindel, the Safety and Health Director of the AFL-CIO, both of whom, both organizations have offered guides for how we can reopen our schools and our businesses in a way that keeps all of us safe. We're also joined by one of the workers who will be asked to go back to work soon, Charles Almanza, a restaurant worker and a leader with One Fair Wage. And we are joined by one of our nation's leading public health experts, Dr. Travis Gayles, the county health officer in the county where I live, in Montgomery County, Maryland. So first, I want to say thank you to all of our panelists for joining us for this important and timely conversation tonight. We know how busy all of you are fighting for all of us, and we really appreciate your time with us tonight. We also very much appreciate the folks who've joined us here on the phone to bring your insight, your questions, and to have this important conversation. So first, Dr. Gayles. Dr. Gayles is an author, a pediatrician, and a longtime public health advocate. Prior to becoming Montgomery County, Maryland's county health officer, Dr. Gayles was the chief medical officer for the HIV/AIDS, hepatitis, STD, and tuberculosis administration and division chief for the District of Columbia STD/TB control, and has spent many years caring for young people who are living with HIV. So Dr. Gayles, I'm a resident of Montgomery County, and I especially want to thank you for all that you and your team are doing. I know you've been working around the clock. As we talk about reopening safely, I'd like to start with your perspective, because we very much want to ground this in science, in evidence, and in what is best for public health, because we know that what's best for public health is best for the economy. So as a public health expert, what do you think we need to put in place in order to reopen? What do we need to look for in order to reopen? What steps should we take to prevent another wave of infections?
Sure. First and foremost, thank you for the opportunity to join you all. This is exciting and glad to see this kind of conversation happening. I think one of the first things that we need to do in terms of determining our next steps is we can't be afraid of science. We can't be afraid of data. And we have to use clinical knowledge to inform our next steps to make sure that whatever actions we take are safe for everyone to move forward. So I think the first part of the conversation is we have to look at information that we have. And so we talk about data. We say, well, it's safe to reopen when we've got 14 consecutive days of downward trending numbers. What does that mean? So we know also in the context, we're asking to test more people. And so as we test more people, we're going to see the number of cases increase. Testing more people is important because it helps us find those individuals who are asymptomatic, who don't know that they have it, and are unknowingly spreading it to other people because we're not interrupting their networks of transmission. So if we can test more of those people, we can find those cases earlier, we can isolate them sooner, and we can prevent other people from coming into contact with them. Now, increasing testing capability is also dependent upon access to testing. We know that in this space of COVID-19, many people have been locked out of being able to get a test because they don't have insurance, they don't have a medical provider. So one of the key steps moving forward that we have to make sure that we continue to invest in is making sure that we invest in opportunities to create and sustain meaningful access to medical care and treatment for all individuals, because we won't have time to wait for an individual to go through an eligibility process, to get a provider, to then get a test and move forward, because during that time period they could transmit to others in the future. So we've got to look at our numbers, we've got to look at the percent of folks who are hospitalized, we've got to look at, again, as we increase the number of folks getting tested, what's the percent of positive tests coming back? So it's not just looking at the raw number of cases, we've got to look at a host of factors and see downward trends in that level to have a sense of optimism that we're moving in the right direction. I think in addition to that, we've got to talk about how we look at public health, not just from a clinical lens. In a number of jurisdictions, we've seen significant disparities in outcomes based upon the number of folks who are getting COVID-19, as well as those who are most adversely impacted when we look at our fatality rates. We have to make sure that all of our steps are not only guided by data, but we also ground them in conversations about how we acknowledge the impact of social determinants of health, such as housing status, food security, access to medical treatment, access to transportation, or the factor that you mentioned, many of the folks who are essential workers who have had to continue to come out to work are disproportionately low-income families who fit and struggle with many of those social determinants I mentioned. So it's important as we move forward that our conversations in terms of building a solid, sustainable public health infrastructure look at the impact of those social determinants on health, and make sure that the policies we put into place are not just focused on a health outcome, but are looking at the holistic impact of all of those factors, so that, God forbid, we have a second wave or a COVID-35 or COVID-26, that we've done the work to correct those things so that we're not seeing such disparate outcomes across the board.
Thank you, Dr. Gayles, and we're so pleased to have you join us tonight. I know there were a lot of folks who wrote in with plenty of questions for you, so we'll get to those in a little bit. Right now, I'm going to turn to Congressman Raskin. I'm very pleased to introduce our special guest, Representative Jamie Raskin. I am lucky enough to be represented by Congressman Raskin and to be his constituent in Congress. He is the representative for Maryland's 8th Congressional District. He's the vice chair of the House Administration Committee, chair of the Oversight Subcommittee on Civil Rights and Civil Liberties, and vice chair of the Judiciary Committee Subcommittee on the Constitution. So in addition to being a constitutional scholar, he is a champion for voting rights, democracy reform, workers' rights, and so much more. Last week, Congressman Raskin, along with Representatives Shalala, Jeffries, Eshoo, and Welch, introduced the Reopen America Act of 2020 with a lot of good ideas that I hope you'll share with us about how we can help states reopen safely. So we are really thrilled to have your leadership in this crisis and honored to have you join us here today, Congressman. Would you share with us, as you think about the next coronavirus relief package, and Congress has done a lot, and there's frankly so much more that needs to be done, what you think needs to be on the table?
Liz, thank you so much for having me, and it's an honor to be with all of the distinguished panelists and to be with you. You're not just my constituent, you are my friend, and you are my leader within the Progressive Caucus Center, and I love getting to work with you. My comments follow naturally from my friend Dr. Travis Gayles, who's been such a great public health leader for us in Montgomery County, where I live too. And look, America doesn't have a plan, is the bottom line. If you ask anybody, what's our plan for getting out of the coronavirus and for reopening America, nobody can tell you what the plan is. We don't have a plan. We have this hodgepodge, helter-skelter chaos that's taking place all over America. The closest thing to a plan we got was the administration 2 weeks ago released some foggy criteria that the states should consider, but nothing about the federal role, nothing about the federal government mobilizing the industrial sector to manufacture the PPEs that we need, to manufacture the ventilators that the patients need, to manufacture the testing kits that we need so we have a real testing strategy. Much less do we have a plan for how our federalism, the federal government and the states working together, will actually execute testing, contact tracing, and institution of isolation, treatment, and the public health protocols that we're going to need on a sustained nationwide basis if we have any hope of getting out of this nightmare. We don't have anything like a plan. So what we introduced 2 weeks ago, you're kind of mentioned our bill, Liz, is the Reopen America Act. I think we now have 75 or 80 co-sponsors. Unfortunately, all of them are Democrats, and no Republicans have come over to the bill yet. But what it says is that the federal government will do those things. The federal government, rather than pitting the states against each other in this brutal race to the bottom for equipment, where our governor, a Republican governor in Maryland, is forced to try to go to South Korea to find pieces of testing kits and then call out the state National Guard to protect this shipment against being pilfered by the federal government, because the federal government is landing at a lot of these shipments and just taking the equipment. Why does the federal government need it if it's not taking responsibility for the supply chain and for keeping the states replenished? Because Donald Trump wants to be able to answer if one of his cronies calls him up and says, can you get us some masks? Can you get us some ventilators? That's it. So they're stealing from the states. So Trump has some stuff to give away as goodies in his characteristically cronyistic fashion. In any event, what our plan says is the federal government will take over the supply chain. It will coordinate the logistics, and rather than having states fighting each other, it will guarantee the states will get the masks that they need, and get the gowns that they need, and get the ventilators and so on. The federal government will take over the testing kits so we can have a scientific advisory panel figure out what are the best ones. And then what we'll say to the states is apply to us for reopening grants. If you want to go off on your own helter-skelter fashion and reopen, that's up to you. We can't compel you. The federal government cannot commandeer the resources of the states, the Supreme Court has said, but we can use our spending power to invite you in. Send us your plan, show us how your hospitals can now accommodate the demand, show us how the curve is going down, meaning the transmission rate for the disease is below 1, meaning each person who's got it is infecting less than one person rather than more than one person. If it's more, you get pandemic conditions like we've seen in New York, like we're starting to see in South Dakota or Nebraska, where it gets out of control. If it's less than 1, you got the disease on the run, okay? That's what we're looking for. Show us those conditions, and then we can approve your plan if you've got aggressive public testing, contact tracing, and we got 30 million newly unemployed people in America, Liz. Let's put those people to work as contact tracers. Let's work on the telephone where essentially they're calling anybody who's been in contact with somebody who's got the disease. So we can make this work. What we need, just like any military general will tell you, any captain of a lacrosse team or soccer team or basketball team tell you, what we need is a plan. And we got no plan, but the plan is here in the Reopen America Act. And then what we need is the social and political cohesion and the direction. We've got to stop undermining and sabotaging the effort, as certain political leaders are doing. We got to stay on the same page to get us out. And we can do this. And that is the historic assignment that all of us have got to embrace at this point.
Thank you, Congressman. And, you know, when we think about what it looks like to actually have a plan to move forward, I've read the Reopening America Act and was really excited to see, you know, the breadth of support. That feels like the kind of legislation that is evidence-based and that will support states in taking the right steps to put people back to work safely. And of course, we know that it's also important that until folks can go back to work safely, that we have a way to provide the income support people need to feed their families. One thing that just I have felt the need to reiterate over and over in this crisis, and of course this is a crowd that knows it, right? But this isn't workers' fault, and it's not businesses' fault, and we need to make sure that folks can stay safe until the measures are in place to return to work. And that's, you know, the robust expansion of our unemployment insurance program and things like Congresswoman Jayapal's Paycheck Guarantee Act to allow workers to continue earning a paycheck until it's possible to return, feel like important measures that we need to make sure accompany a plan to reopen. I want to turn to President Weingarten next. I'm so happy to be joined by the president, the AFT president, Randi Weingarten, and also by Rebecca Reindel, the health and safety director of the AFL-CIO, two friends from the labor movement who have been working hard to think about how we can protect the safety of all of our workers. And I'm going to start with President Weingarten, who represents the 1.7 million members of the American Federation of Teachers, the AFL-CIO. She was elected in 2008, following 12 years as president of New York City's United Federation of Teachers and 6 years as a teacher at Clara Barton High School. President Weingarten, I have two kids who are now distance learning their way through 4th and 7th grade in Montgomery County schools. And they just learned yesterday that their schools are going to be closed through the end of the year. And I want to give a huge shout out to all of the educators in their lives and in all our kids' lives who are really a lifeline for our kids right now. The daily presence of the teachers who my kids are seeing on the video screen makes all the difference for them. It just really couldn't be more important. And, you know, I think our teachers do this work the same way they do their work all year round. They don't get a lot of gratitude, right? I don't know that the kids often say thank you, and we as parents forget. But I think in this time of pandemic, it has just really been hit home for me what a calling it is to be a teacher. So I was thrilled to learn last week that the AFT had released this critically important plan with input from our educators about how we can reopen in a way that keeps our kids, our teachers, and our community safe. And President Weingarten, I want to turn to you to ask you how you and your members across the country are thinking about first, this really dynamic and innovative teaching that is happening in new ways as you figure out how to protect our students, but also help them continue to learn. So can we start there? I'd love to just hear a little bit about, you know, the distance learning that you're putting in place.
And let me just also say that one of the people we consulted was Representative Raskin's colleague, who worked with him and others to do that fantastic bill. I was on the phone with Donna Shalala myself for several hours in the construction of that plan, and you'll see a lot of similarities, and she and your plan really, really helped us think through kind of the steps that we needed to take. Look, we're in a very, first off, thank you, Liz, and thank you to all the parents on the phone. And I was with, you know, in our kind of isolation quarantine hub, our niece and our great niece are part of that hub. So I was kind of able to watch her close up for the hour that she was doing Zoom learning with her teacher a couple of days ago. And it is part of what we're doing. One second, let me just close the door here. Part of what we're doing is, sorry that I'm taking you, closing the door so you don't hear the other stuff in the other room. part of what went on here is that everyone turned on a dime to close schools and to do remote learning. And if you hear anger in my voice, it's because if we did our first press conference on coronavirus the day of the State of the Union, February 2nd, you know, none of us are stupid. You could see what was going on in Wuhan. You could hear what the WHO was saying. Why the hell didn't our, sorry for my language, didn't our, you know, administration do what they needed to do to prepare and protect so that we could actually have the stockpile we needed of PPE? By the way, with the with the 200,000 healthcare members we have, as well as over 700,000 or 900,000 education members we just bought $3 million worth of PPE, 1 million face masks, 50,000 face shields, almost 500,000 N95s, so we could get this material to people. It is, you know, and it's ridiculous that we've had to go to China and all sorts of places. And the press, all the press wanted to know today was, how the heck did we do it? But it's ridiculous that Trump is not doing his job and we had to do this. So my point in saying this is the healthcare workers don't have the PPE they need, and yet they are risking their lives every day. The educators didn't have what they needed, and yet they turned on a dime to try to engage kids, keep kids off the streets, and also try to figure out the instruction for the rest of the year, including summing up the year with capstone projects and things like that. And frankly, if they weren't doing such a good job, we'd be hearing a lot more negativity about what's going on in terms of America right now. But what's happened is teachers all across America are really trying to engage. They're trying to ensure that kids are calm. They're trying to make sure that we bolster kids' confidence, we decrease their anxiety, and we try to figure out how to land the plane and sum the year up. I've heard so many different stories, but you know, ones I love is like a teacher in New York kind of going through her basement, trying to figure out, you know, how she could sing and dance and have poster board and all sorts of things and doing the Zoom stuff. Then the Google Teams and all this other, and many people have been learning as they've been going. But watching kids being so connected to their teachers has been amazing. We've had in Share My Lesson, one of the groups that we have lots of resources that we've put out, and I just want to put a couple of them out here now. Share My Lesson, it's on our website, it's free. We refresh the tips of the trade for parents, for social emotional issues, for curriculum issues every single day. We also have gotten, in the first couple of weeks of the pandemic, one week we had a webinar, over 60,000 people came to that webinar. We've had meetings with we do Tuesday town halls. We had one with the National PTA. We had almost 60,000 parents and teachers on that call. We've been trying to do what we need to do, which is give teachers the support they need, as well as giving parents some advice. And I'll kind of end with, and if you want to see some of the stories, every day we put out an AFT Voices story about some magic that's been happening between teachers and kids. Mm-hmm. The last thing I'll say though on this is the ingenuity has been great. People are trying their best. 40% of our kids don't have connectivity. Somebody asked what the AFT is. It's the American Federation of Teachers. 40% of our kids don't have connectivity. Many teachers or parents go to the school parking lot in cars to try to get some of the Wi-Fi from a school or from a mall. This learning, as important as it was to engage and to empower, is a very, very, very bad substitute. It is not a substitute for bricks and mortar schools. We got to get back to bricks and mortar schools. We got to figure out how to do it gradually, safely, and responsibly. But that is really the way that we're going to build resilience, build confidence, build relationships, and think about using next year as a way of bridging what has happened this year. Thank you.
Well, President Weingarten, I think that really leads to my next question for you, which is how do we get back? And I know you released a plan, AFT released a plan last week with input from educators all across the country. And I'd love to hear from you about that plan and about what it's going to take.
Wait, let me, because I don't want to dominate the conversation, so let me talk about that. It's on our website, but this is what's so heartbreaking right now. In previous administrations, they weren't, terribly progressive in most instances, but the CDC was godlike for us. Meaning the CDC followed the science and the CDC tried to figure out what we needed to do in a public health emergency. You saw today that Trump refused to let the CDC even put out a plan. And we've also seen, and I see Rebecca shaking her head, how the CDC has loosened up a whole bunch of guidelines and safeguards on PPE and so many other things because of the lack of the supply chain. So what we realized, this is before Trump basically surrendered to the disease and decided that death didn't matter and he was just going to reopen regardless. And we said that if we're going to try to figure out a way to reopen the economy, you have to reopen schools because it's not just the custodial function. The custodial function is really important for parents to be able to actually go to work instead of working from home. And all of the equity issues that I just negated in saying that, because so many parents don't work from home, can't work from home. But then the second piece is, how do we deal with all of the instructional and the anxiety and the mental health issues? And we need to get kids back together and back in school if we can. So our idea was maybe there could be a voluntary summer program if it was safe enough to do it. And then we realized, given that there's no real guidance from the federal government, what do we do to tell people what to do? And how do we try to open schools in the fall? And so the 5 things that we said, 2 were public health issues. 1 was about education itself. 1 was about who should make these decisions. And the last was what, Jamie Raskin and Progressive Caucus and others have been trying to do. We need the money to get it done. This is actually going to cost more money, not less money. So the 5 pieces are, and then I'll answer questions about it if people want. The good doctor knows this and talked about this far more than I can. You have to, in a community, maintain the stay-at-place orders, the physical distancing orders, until the number of cases decline for 14 days. In the absence of a vaccine, you have to actually have the least amount of virus in a community. Second, you have to do the testing, the tracing, the isolation that the good doctor just talked to us about. If Donald Trump and Mike Pence are the only one who gets rapid testing, how is that going to help the rest of the world? And if you don't have that kind of rapid testing and then the tracing and then the isolation, then you don't actually know who is carrying the virus. And you don't know, and you can't contain it, and you can't deal with the spikes. Then if you don't have enough rapid testing, and you don't have enough tracing, and you don't have enough of the kind of isolation that you need to do if you've been in contact with somebody who's positive, then the issues around school become even harder, which is, how do we make sure that Randi, the teacher, is not walking into school COVID positive, or if Randi's niece, Liz, is not walking into the school COVID positive. So we have to have some screening, but if the screening is not rapid testing, if the screening is a temperature taken or just asking a question, then if you don't have the physical distancing, then you're not going to be able to do whatever we can to assure parents and teachers and kids that we're not transmitting virus. So that's why the third point is how we marry the physical, the public health tools like washing hands, physical distancing, cleaning the school at night, masks. How do we marry that with the educational strategies? And this report is chock full of all those different things to think of. Like, do you lower class size? Do you stagger the day? What do you do in terms of these things? How do you help ELL kids? How do you have special needs kids? That's why it's 22 pages long. A lot of those kind of questions. The fourth is, who's making these decisions? Yes, a governor does, but the nitty-gritty has to be done in the ground. It has to be done in the school. And an elementary school is going to be different than a high school. It's going to be different than a middle school. And so we need to have parents and teachers on the ground contouring it and making those decisions. And last, you hear from everything I've just said, which is how to do it, that this will cost more money, not less. And that's part of the reason why we are completely 1,000,000% in support of Nancy Pelosi, Speaker Pelosi's plan for $1 trillion for local and states and schools. We probably, we need whatever we can get, but if you gotta clean the school every day, if you stagger, for example, morning for some kids, afternoon for other kids, you're gonna be cleaning the school twice. You're gonna be having 2 different sets of bus routes. That's gonna cost more money, not less money. So I can answer more of the questions. And I'm not saying that we are, the only ones, but we haven't had advice from the CDC. Thankfully, we've had advice from, Congressman Raskin, Congresswoman Shalala, from the public health experts. But how are we going to really do it if we don't plan now and really work together on that? Thank you.
Thank you, President Weingarten. One of the things that we believe at the Congressional Progressive Caucus Center is that the best policy is made when we listen to folks who are expert in their own jobs, their own vocations, their own lives. And I think hearing you talk and the specificity with which you just walked us through what now that you've said it, like clearly common sense, but frankly, that I would never have come up with because I'm not an educator, right? And it makes such a difference for policymakers to be able to engage with you and to learn from you. And that's why we also asked Rebecca Reindel, the Safety and Health Director of the AFL-CIO, to join us here tonight as well to share the perspective of labor union members from across occupations and industries on what we need to do to return to work safely. And so, Rebecca, I wanted to ask what you would add to the points that President Weingarten just made.
Hi, can you hear me okay?
We hear you great.
Great, thanks Liz. And it's really great to be here with the caucus and with all of you on the panel. I'm just going to talk briefly about a plan that the AFL-CIO released. It's called the Safety First Plan, about reopening the economy. We did that about 3 weeks ago because the administration was not acting. And as so many of the speakers already said, and President Weingarten really laid out well, We're getting a lot of misinformation out of this administration. The guidelines are not based in evidence. They're not based in science. There's no leadership. And so we really felt we had to put these out there because really where most work exposures are happening right now are in the workplace. And we are so centered on this reopening the economy plan is so centered on workplace safety, because we heard a lot about when the economy was going to open, and we didn't hear much about how it should reopen. It was all about when, and nobody, not nobody, but nobody in the administration was talking about what we need to put in place to ensure that workers are safe when they go to work. We want to make sure that workers in healthcare and transit and meatpacking and utilities and factories and construction and groceries and schools and so many other workplaces have the common sense workplace safety protections that they need in order to be at work. And that goes for people who are at work right now during this pandemic and those who are going to be called to return to work. So some of these measures include making sure that workers are a key part of the decision making. It's their lives that are on the line. And it's pretty clear that there aren't adequate safety measures in place right now, but we need them at the table. We need workers' voices at the table. We need unions, and this needs to be at city, state, federal, at workplace level, decision-making around what conditions need to be in place in order for workers to be safe on the job. Decisions, as you said already, Liz, that these decisions need to be based on worker safety and on sound science. So far, we haven't seen that being as strong as it really needs to be. This plan includes a call for clear, enforceable workplace health and safety standards. And we've been calling on OSHA to issue an emergency COVID-19 workplace safety standard out of OSHA. That's the agency that's in charge of protecting so many workers' health and safety on the job. And we're calling on them to issue a COVID-19 workplace safety plan. Everybody who has to be at work right now should be covered by a COVID-19 workplace health and safety plan. And it's OSHA's job to oversee that employers are doing that. And that's something that they haven't done, that the agencies have stalled on doing, that they've they've stalled, they've sort of become defensive, they've haven't given real answers as to why they can't issue this standard. We need an emergency temporary standard out of the agency, and we need it now. And we need workers to not be retaliated when they're speaking up about unsafe working conditions. And so if people are expected to be in workplaces right now, we need they need to be able to expect their employer that they'll follow a strict safety plan. And so that's something that's really, Congressman Raskin was saying, it's all over the place. The plans are all over the place. And that's really what we're seeing in the workplace health and safety world as well. And these workplace measures need to be on top of these strong public health measures that interact so closely with the workplace right now, that we also haven't seen. So rapid and reliable testing, people going into work who may be sick or other crowded conditions, working near each other, or exposed to the public, working directly with the public. Contact tracing and tracking worker infections and understanding where those main outbreaks are happening, what workplaces there are these, so-called hotspots, right? And being able to identify those early for prevention and for contact tracing. And if sick workers, we need those folks protected from the loss of pay, loss of benefits, and loss of employment. If they get COVID-19 because of their work, they should not be punished for that. So, the bottom line here is that the workplaces are so centered right now to what's going on in our communities, that if our communities cannot be, if our workplaces cannot be safe, then our communities can't be safe. And we need those to go hand in hand. So that's really where this plan came from.
Thank you so much, Rebecca, for joining us. And I think the points that the AFL and other unions have been making loudly and clearly about the need for OSHA to step in and put workplace safety standards in place are just so very important. I want to turn to Charles Almanza now. Charles, we're so glad that you could join us tonight. Charles is with the One Fair Wage campaign, and I understand, and I'm very sorry to hear that you have been furloughed due to the coronavirus during this pandemic. Can you tell us about the job you were furloughed from and what you've been experiencing since the crisis started? And I think it would also be great to hear your thoughts on what you'd like to see in place in order to feel safe going back to work.
Yeah, sure, definitely. It'll be my pleasure. So my name is Charles, right? I've actually been in hospitality since I was very, very young. My family, they immigrated here from Nicaragua during the Civil War in the 80s. And in order to make money, they opened up a kitchen and sold food out of their vans. So I grew up in kitchens and restaurants and bars like my whole life. This is my passion. This is, hospitality is something that I really, really love doing. And I just wanted to say thank you to everyone on this panel, because I feel like we're all in this together. And it's nice to know that we all care about the same thing, which is making sure that we are all safe and when we get back to work. And I really appreciate everyone who is watching this, live broadcast, because I feel like it makes me feel like we're all in this together. Do you know what I mean? So the bar that I was, that closed, actually, the last bar that I worked at was called Star Bar in Bushwick. And like I said, I've been in hospitality for years, since I was a little kid. And this is by far my favorite place that I've ever worked. So I was very, very sad when it closed due to COVID-19. And thankfully I was able to get on unemployment after, dealing with being on the phone for like 8 hours a day for like a good week. The thing about that is that with unemployment insurance, it takes the average paycheck that you got from the last 18 months. And last year I worked at a bar in Brooklyn where the employer just didn't pay us at all. We lived off of our tips, and I worked 70-hour weeks, which is very, very common for people who are in hospitality. I was on my feet 14 hours a day, and when you work so much, it's nearly impossible to look for another job, because you're there 70 hours. I spent more time at that bar than I did with my cats at home. If you're living from paycheck to paycheck, it's just impossible to look for another job. So naturally, because I wasn't making enough money, I was threatened with eviction. I was worried about being homeless. I remember I couldn't even feed my cats any food besides rice and beans, which they enjoyed, thankfully, but still, like, the thing is, the sad part is I'm not alone. Like, I'm not the only person who's been through something like that. Wage theft is pretty common because of this thing called a sub-minimum wage for tip workers. And in 43 different states in these United States of America, it is legal for employers to pay you $2.13 if you receive tips in 43 states in 2020. So in my case, I wasn't paid at all. And I think with something like a sub-minimum wage, I think both workers and employees see the wage is not important and the tips are more important. But it's illegal to just not pay your employees. So when I was laid off due to the coronavirus crisis and went to apply for unemployment, it was a difficult process because on paper, it looks like I only made $5,000, which were my credit card tips for the 7-month period. And it doesn't look like I worked more than that. So that drastically affected my unemployment claim. So I'm getting somewhere around half of the amount of money that you would get if you got like the maximum, which is something like $504. So if New York had like a one fair wage, like $15 an hour, like they do in California, I would have been paid a full wage by my boss, and I would be getting almost $500 in unemployment for the state of New York. And the thing is, the reason that I'm here is because 10 million restaurant workers have lost their jobs nationwide. And most of us are not getting unemployment insurance because most of us were not paid. And there's no record of us being paid. And it's not in the system. And the government can't vouch for the fact that we were working. So this is why I'm here, is because this is one of the things that we need. We need one fair wage. We need to make sure that we have a decent paycheck so that we're not worried about whether we should feed our cats or not, where we could pay rent, where we can survive.
Mm-hmm. Thank you so much, Charles, for being here and for the advocacy work that you're doing for one fair wage. I think one of the things that the pandemic has really exposed is all of the ways in which our economy is badly broken, and the inequality that has persisted for so long in our economy, and the sub-minimum 213 wages is unconscionable, but that is what we've had for a very, very long time. And that makes the effects of a crisis like this so much worse on so many people, right? And so this is a moment we all have to say we're going to want to return to normal, because normal was very bad for a whole lot of people. We actually want to build back better. And I really appreciate the work that you're doing to make that happen. So thank you very much. We have questions that I want to turn to, because there are a lot of folks who've joined us here on the phone who have questions that they'd like to ask of all of our panelists. Congressman Raskin, I'm going to start with you. So we have a question from Judy in New Jersey. She says, Senator McConnell is pushing to give companies protection from liability and threatening to block the help we need if they don't get it. And how can we make sure that corporations can't just throw away their workers' lives and then get away with it? And I think this really follows on Charles's description of wage theft, which is frankly rampant. How do we prevent those things from happening when folks return to work, and how do we push back on this idea that employers should be absolved of liability in order for there to be more relief?
Great question, because Mitch McConnell would love nothing more than for the next round of legislation where the Democrats want to invest in state governments and local governments and public health, hospitals, testing, contact tracing. He would like to make this into a power grab. He would like to make it a power grab for big corporations to deal themselves immunity from liability. By the way, and not just for COVID-19 related litigation, but for other stuff. I mean, big gas and big oil was trying to cut itself a deal to buy immunity, relief from any liability in the last round. And somebody blew the whistle on it, but it was tucked in there. I wrote a letter, which I think 65 or 70 House members have joined on, to the leadership saying, let's be certain that the carbon kings can't buy themselves immunity from lawsuits over climate change, which is really what they want. But the real question here is, what should liability be for COVID-19? I mean, it's very tough to sue an employer, a restaurant, or anybody if they behave reasonably. For most of the time, nobody knew anything about it. Now, if a workplace knows that people have COVID-19 and compels other workers to go in and doesn't take precautions, then they should be liable for whatever the damages are coming out of that. So I think we're going to have a very big fight about this in principle. You know, we've been doing everything we can to help small businesses, and small businesses have overwhelmingly been behaving responsibly. And there's money for big businesses, $500 billion. Mitch McConnell made sure for the cruise industry, the airline industry, the hotels, and so on. So we're bailing everybody out, but we shouldn't bail people out from the consequences of their own deliberately criminal or reckless actions. That doesn't make any sense. So I'm with the call on that. Look, we've lost 72,000 people so far in 3 months. In 3 months, we've lost more people than we lost, more Americans than we lost in Vietnam, Iraq, and the Afghanistan wars. We've lost more people in 3 months than we lost in all three of those wars. We've got half the states opening up where the trend lines are in the wrong direction, as Dr. Gayles described it. The numbers are going up. The transmission rate is more than 1. So this is a dangerous situation where the lethal indifference and ignorance of the Trump administration is coming back to haunt us every single day in the fatality numbers that we're receiving.
Thank you, Congressman. I want to turn to Dr. Gayles for this next question. It's from Kiana in Montgomery County. So Kiana is raising a really important issue, the issue of outbreaks in jails and prisons and people who are dying. What can our public health officials do to keep incarcerated people safe? And what can we do to just ensure that folks are kept healthy and to prevent folks in prison contracting coronavirus?
Sure, that's an excellent question. I think this goes back to testing capacity, particularly given that we know, and this is the same case principle for nursing homes, that these folks who are in there, whether we're talking about incarcerated individuals or nursing home residents or long-term care facility residents, are stable. They're not coming and going. And so we have to make sure that we have increased testing capacity to be able to diagnose our essential workers and staff who are coming and going, to know their status, to minimize their exposure to the incarcerated individuals or residents, making sure that there are adequate provisions in place for the staff to wear as well as for the incarcerated individuals, quickly identifying any individuals who are symptomatic and coming up with strategies to be able to cohort them in one confined space, having dedicated staff work closely with them, again, to try to minimize any further transmission to other folks who come into contact with their networks. I know here in Montgomery County, we had a very proactive effort. We have had some cases pop up, but the team from the very beginning was doing very proactive screening when they had new inmates coming in, as well as doing temperature checks for their staff members. One of the unfortunate things that has complicated our ability to manage this in that setting, as well as again in other spaces like nursing homes, is that there was a window of time where we did not know, or did not, the science didn't recommend that asymptomatic individuals could transmit the virus. And so during that time period, you had folks coming in, we were checking for temperatures. They didn't have temperatures, but they still had COVID-19. Now that we know that, we've put in further restrictions in terms of face coverings, personal protective equipment when working with different residents and so forth. And so moving forward, now that we know better, we can take more proactive steps and further emphasize that those protective measures are enforced.
Mm-hmm. Thank you, Dr. Gayles. The next question is for President Weingarten. President Weingarten, this question comes from Julie in Philadelphia, and she asks a question that I wanted to raise here because so many parents have the same question. I know closing the schools was important to bend the curve, and I want to keep my kids safe. My son has sensory and auditory sensitivities, and Zoom learning is just incredibly hard for him. And what is being done, or what could be done, to make sure that students with sensitivities or learning disabilities don't get left behind in virtual learning? And I'll add to that question. I'm guessing you will address that the rights under the IDEA don't stop just because kids are at home. And I know Montgomery County has actually done a phenomenal job of continuing accommodations plans for kids who are distance learning, but would love to hear from you, President Weingarten, on that question.
Look, it is just one of any number of inequalities that have been widened and exacerbated, have been exposed, exacerbated, widened in this crisis. And the, you know, one of the reasons that we have tried to figure out different kinds of alternatives, like, you know, can we have the Medicaid, you know, many kids who have IEPs under the IDEA also have other kind of supplements under 504 or Medicaid. And we've been trying to figure out if there are other ways of trying to get services done, you know, given all the physical distancing. We actually like the Murphy-Cassidy bill that tried to create other funding streams for creative ways of trying to deal with, you know, kids who have, you know, learn differently. And we know that this is going to be absolutely imperative, as frankly, the first kids to come back to school, to the extent that they are not, you know, they can do that safely. It's one of the things that have actually really pushed us to think about reopening, because, you know, screen learning is not good for all kids. And in different places in the country, you know, I've seen people, for example, you know, sit on kids' lawns and do some learning in that regard. I've also seen different examples, like having learning in rec centers and things like that. But as Dr. Gayles said, part of what we also need to do is, in some of these instances, make sure we have the testing that's necessary to create an environment even right now. So it's an example of yet one of the myriad examples of why, you know, virtual is not the be all and the end all. But this, but different districts have really been trying to figure out ways of helping kids who are not really amenable to being in front of the screen.
Mm-hmm, mm-hmm. Thank you, President Weingarten. And I want to address a question to Congressman Raskin, and this is from Max in Silver Spring. So Max asked this question. He says, state and local governments are on the front lines of this pandemic, and some of them are about to go broke. How do we make sure they don't have to lay off city staff like me who are keeping everything going?
We're going to denominate the next bill the HEROES Act, named after, I sent Pelosi my definition of the acronym. I think it's healthcare workers, educators, responders, officers of law enforcement, emergency responders, teachers are in there, Randy, you can be sure. But anyway, that's what state and local government is. You know, the Republicans would like to portray it as some big behemoth bureaucracy. It's just the people that we all depend on for our families, for our kids, water, sewer, cops, firefighters, emergency responders. It's coming. So we've got, I am willing to bet that at least $500 billion is allocated towards that purpose in the House, maybe more than that, maybe a separate appropriation directly for local governments, and the 500 could be for the states. I think all the numbers are still being negotiated and played with, but it's a lot of money because there are plummeting revenues for the state and local governments because all these businesses are closing, and you know, nobody's paying gas taxes, for example, because nobody's driving anywhere. So it's a crisis situation. There's so much spreading unemployment. The demands have never been higher for the services of the state and local governments, but the revenues are going down. That's what the federal government is for. And Liz, like, that's what I'm trying to emphasize. Like, this is a test of American federalism. Just like the corruption we dealt with was a test of the separation of powers. And from my perspective, the House of Representatives passed and the Senate failed. but we're back in the same situation now. It's a test of American federalism. Can we reclaim the proper role for the federal government to put money out to say, we will fund your reopening if you do it the right way, if it's based on science, if it's based on public health principles, we will invest in it. We will work as partners together with every governor in the country, left, right, Democrat, Republican, independent, whatever it is, we will work with all of them. We can do that. This is the United States of America. Remember, we created federalism. This used to work. Instead, they put out some flabby criteria for the states to consider. It's like FDR in the middle of the New Deal, instead of creating the Civilian Conservation Corps and creating all of the federal agencies that made America move again, he puts out some guidelines to the states on what to think about when you're trying to revive your economy. I mean, come on, that's not going to work. That's a recipe for chaos. And so, you know, this is, unfortunately, it's not like the New Deal because you don't have Congress and the president working together. It's more like Reconstruction, where Congress knew what needed to be done, and you had a president, Andrew Johnson, who's dragging his feet and trying to frustrate and undermine the effort. But we've got to move forward to put a real plan on the table, because what we're seeing is not working already. And we're going to see a huge spike in the states that reopen prematurely without any plan. So thank you for raising that. We've got to do it with the states. We've got to do it with the local governments. And I love the plan that Randi put together for AFT. When the states put their plans together, they're going to be able to have that kind of fine-grained detail from each social domain. So K through 6 and 6 through 12 and colleges and universities and the workplace and stadiums and nightclubs and bars and restaurants. It's not going to happen by the president declaring one day he's King Kong and here's my edict and now go follow this, without any investment in making it happen, and then careening from crisis to crisis and changing his point of view every single day. Come on, that is not going to work for getting the world's greatest democracy out of this crisis. And we're seeing it happen all over the world. Can we do this? You know, it's up to us. If the progressives don't lead, who's going to lead? Thank you for doing this, Liz Watson. I yield back.
Thank you, Congressman. Okay, Aaron, the next question is a really hard one. And I don't know that there's certainly not an easy answer, but let me just pose it to you. This is from an anonymous person here. So this person asks, if our bosses are telling us to go back to work before it's safe, what do we do? What do we do if we don't feel it's safe? Is it worth the risk? I work in a hair salon and I live paycheck to paycheck, but I'm also a mom and I don't want to risk my family's health. What do I do? So this question, I'm going to turn to Dr. Gayles, and if we can probably take one more answer, and if there's another person who would like to answer it.
Well, that is an excellent question, and it's a tricky question, and it speaks to the heart of all of this. How do we balance economics and health? And the sad thing is, I don't think we should be forced to be put in situations where it's an either or. We should be able to come up with policies that effectively address economics, but are also promoting public health principles to keep people safe. For this particular person, what I would encourage them to do, I can't speak on the labor law side of things, but what I would encourage them to do is to continue to advocate for themselves, make sure that they do request and have on hand the right provisions in terms of personal protective equipment, and that all of those different procedures and practices that we have put into place are enforced. I can say this for the state of Maryland, if you work for an employer who doesn't have those things in place, there are reporting mechanisms that you can report that to the local level, and also make those provisions to the state level so that those practices are enforced and that you have the safety precautions in place that you need. And even in some situations, there may be a determination from the state level and local level that that business doesn't need to function and you still need to stay at.
Thank you, Dr. Gayles. I'll take another answer to that question if there's anyone else who wants to address it. It's a hard one. And there were more questions coming in the chat as you were giving your answer. Charles, is there anything you'd like to add as someone who's in the same room?
Oh, was it obvious on my face that I wanted to answer? I mean, how do I put this? I might be going back to work sometime soon, you know, and I think people in hospitality, whether you're doing someone's hair or whether you're bartending or whether you're serving tables, if you work in that industry, we're on the front lines. And before we shut down across the country, maybe a month or two ago, I remember talking to my coworkers and I remember thinking, like, if we get it, like, that's it, you know, like nobody else is safe because we are that front along. I mean, doctors and people who work in the medical profession obviously have it worse than us, but like we deal with hundreds and hundreds of people every day. So I think I understand the need to work. I understand that we want to work. I want to go back to work at some point in time. But the issue is, it's not that we don't understand this. I think the issue is keeping people safe. You know, a haircut and a pedicure, I don't think is worth losing lives over, and that's not entirely her fault. You know, I think she's definitely put in a harder place than I am. But I think that the thing that Dr. Gayles said really makes sense. You do need to continue to advocate for yourself. You know, we can't go back to normal when we have no testing and we have no healthcare and we have a minimum wage of $2. You know, we can't, like, if we do go back to work, we need to talk about things like hazard pay that are on the table, that there has to be discussion about hazard pay if we're going to have to go back to work. You know, if we're going to be risking our lives so that other people could get the products and services that they want, then we need something like that on the table. And I don't think that it should just fall on the shoulders of small businesses. There needs to be a slate of mechanisms and policies put in place by a competent administration in order to make sure that all Americans are taken care of. You know, we need all of these things, and what we need is for the federal government to do its job to assist small businesses and employers in protecting Americans across this country. You know, and we do that by providing one fair wage and universal health care and paid time off. And we need to fight to make sure that our rights are protected. What we need to do is categorically reject the cruel incompetence of the current administration by pushing for better policies, because this is about saving lives. Sorry.
Don't be sorry.
Liz, could I add one little thing to this? The question posed was also posed recently by meatpackers in Missouri. You know, President Trump, who refused to exercise his powers under the Defense Logistics Act to manufacture equipment like the ventilators and the masks and so on, used it to order the meatpacking industry to stay open. And so they're all opening. So they ordered their workers back to work. And these workers in Missouri said, we can't go back under these conditions because you don't have 6 feet distancing. You don't have a mask rule. And the employer said it's safe. They brought a lawsuit, and yesterday, a right-wing Republican who was operating from his house because the federal courthouse was closed, it wasn't safe, said it was perfectly safe the way the employers had set it up, and the employees should just trust the employer on that. So the question that was just posed is a question that's being asked all across the country, and workers are going to have to demand through the labor movement and the unions and through their representatives the right to a safe workplace now. And hopefully in this next round of legislation, we get the emergency OSHA rule we've been demanding legislated into law.
Absolutely. The emergency rule, sorry.
Well, Liz, I just wanted to just piggyback on what Jamie said and what, Charles and Dr. Gayles said. This is what the labor movement is built for. We have to be that protective coating. We have to be the Upton Sinclair of this generation. That's our job. And so that is part of why we are pushing for that OSHA rule, because if somebody then gets retaliated for saying, no, I gotta wear a mask. I know that doesn't look good, but maybe I gotta wear a mask when I am cutting hair or doing this stuff, or we need to demand these things. And the person gets fired and there's retaliation because of trying to be safe. That's what we need to do to help that person and to help others in solidarity. There will be people who get fired. We need to take these causes on, and we need to, because if we don't, shame on us.
Well, in this moment, I'm so thankful to the labor movement for the work that you're doing to stand up for workers all across this country, who are being put at risk in this pandemic. I'm grateful to Congressman Jamie Raskin for the work that he's doing to make sure that our policymakers actually put the policies in place that make sure that when people return to work, they are safe, and while they're home, they have income support. And to all of our panelists here on this call, to Dr. Travis Gayles, who's working so hard for the residents of Montgomery County, to Rebecca Reindel with the AFL-CIO, and to Charles Almanza, who joined us, and really, I think, just spoke truth to power exactly about what needs to happen next. So we have had a really incredible lineup here tonight. The information that you shared has been invaluable. I have been asked by my, shout out to my amazing team, go Jess, Lauren, Hiba, and Kenton, you're awesome. Thank you for putting this together. They want folks on the phone to know, those of you who stuck with us here to the end, that we will be joined next week by Representative Rashida Tlaib and leaders of the We Demand More Coalition. So you can tune in for our dispatch from the front lines next week. The We Demand More Coalition is fighting to ensure that Congress puts the needs of women and families first and ahead of corporate profit in the response to the COVID-19 pandemic. You can find the link to register in the chat or in the comment section right now. I think Jess has just loaded that up into the comments in the chat. I want to say thank you to all of you for the work that you are doing to keep us all safe and to help make sure that we have a recovery that actually makes us a more just, equitable, and resilient nation than we were when this pandemic started. And we're only going to have that if we fight for it. And that's a fight that we're all in together. And I am so proud to be doing that with all of you here on the call. So thank you to our really wonderful panelists for joining us here tonight and for the information that you shared. Thanks to all of you who joined us on this call from across the country. Please, everyone, keep on fighting for what we all need to stay safe in this pandemic. And please yourselves continue following the work, following the advice of your public health official to keep yourselves and your families safe. And just a lot of love for our educators out there across the country. Thank you for the work that you do. You're the lifeline for our kids, and we appreciate you.